This is the Ohio Adult Allies Podcast. Welcome. Here, our mission is to develop, inspire, and empower youth leaders. Our topic for today is addressing social and structural determinants of adolescent health in BIPOC communities, with special guest George Hicks. Now here's our host, Christine McGill.
Welcome to the Ohio Adult Allies podcast series. I'm Christine McGill, project manager at Ohio University. In this capacity, I work to advance efforts of the Ohio Adult Allies Initiative, supporting adult allies to empower youth and creating social change. We are excited to have Mr. George Hicks with us today. George has over 25 years of program development and resources. He coordinates programs in both schools and community settings. George works to identify the prevention needs of target populations. George has extensive experience working with urban youth in Columbus, Ohio area. He is currently partnered with the City of Columbus Recreation and Parks, Mary Haven Gambling Intervention Program, and ArkBuilders Inc, Columbus Health Department, Asian American Community Services, Lead the Way Learning Academy, and Capital University. We would like to welcome Mr. George Hicks. Now, Ohio Adult Allies is always striving to be inclusive and to provide opportunities to have conversation around a multitude of topics, especially around creating brave spaces where all individuals have voice and choice. Our focus today will be centered around the systems and other social factors that may empower or inhibit BIPOC youth who live, love, and work within our communities. Now, George, you are someone who has extensive experience working across all types of contexts, including as a leader in adult allyship and youth-led prevention. And your insight is essential to us understanding how to create equitable spaces and opportunities for BIPOC youth. But before we move forward, I wanted to kind of get your perspective on how you define BIPOC.
Okay. First of all, thank you, Tina. Good being with you this morning. Let's have some fun. I want to go in a lot of different ways, but basically the definition of BIPOC is Black, Indigenous, People of Color. Now, it's a relatively new term, at least to me, and some in the field and the community have said, why do we need a new term? But I said, well, that's the one we're using now, so be patient with us. And it's interesting when you work with new communities, they don't know what BIPOC means, but once you explain it to them, it's really, we want to be inclusive of all people. And we know that different groups have different needs. So it's Black, Indigenous, People of Color.
Okay. Thank you for that explanation. How do you feel that self-identification or even being identified by others as BIPOC can relate to the structural or social determinants of adolescent health?
Wow. Well, first of all, can I step back just because I want to say it is a privilege to be able to work with diverse communities. I didn't stumble into it, but it seems like we really have an open door now, particularly in youth-led, because a lot of our particularly new Americans and immigrant communities, the second generation, they are really ready to help address the issue in their community. And normally most immigrant communities, Black communities, a lot of social determinants like poverty, poor education, environmental issues, they encounter those every day. So one of the reasons I love youth-led program is that we can empower kids to address those issues. And so it's like maybe the older generation doesn't feel like these issues can be addressed and changed, but the younger generation, they know they can. So because we know that social determinants of health also are risk factors, in our language, in our lingo, as preventionists, we are trying to minimize the risk factors. So by identifying these as risk factors, then we can address them with protective factors. And that's where youth led.
I love that switch where we're talking about identifying things that may be traditionally or historically seen as a risk, but then shifting it to how can we use that as a strength for our young people? So thank you. So you are the president of ArkBuilders, and you're also a regional learning collaborative leader, and you work with BIPOC, AAPI, Hispanic, Latino, Latina, Latinx communities. Having worked with these communities and these capacities for several years, why do you feel it's important for those working with BIPOC youth to know about social determinants, adolescent health?
It's important for many reasons, but let me take a step back. Working with these communities, I think we first need to understand how to engage the different communities. And we use a word called, a lot of people use it, cultural competence. I prefer cultural humility, because if you're going to deal with different communities, I don't care what community, rural, urban, suburban, BIPOC, there has to be a humility. And that's what I found. It's like, we're talking about cultures. We're talking about hundreds of years of culture. You're never going to, I read one article, it's like learning a language. You don't learn a language in 5 simple lessons on Babel, right? It takes one expert says it takes 5 to 7 years to learn a language. Well, I would say the same thing about culture. So if we're going to, as we reach out to BIPOC communities, the first thing we need is, we call it steps of engagement, is humility. That you're on a journey with people. We know we have, and I believe this, we know we have empowering practices for any community. But if you don't have what we call the license to operate, they're not going to let you in, particularly in this culture, particularly coming out of COVID, the isolation, new Americans, if they've come from a traumatic background, and just political culture, people feeling like they're not welcome, then that humility is so important. And getting the permission, we call it, again, license to operate, permission to work in their community. And the last thing is relationships. As preventionists, you know that we build relationships. And once you build a relationship, then you can have conversations around these determinants of health. And together we can begin to address them. So I just had to go back to this.
Just for clarity, when you're talking about, permission and license to operate, are you talking about those relationships, and only until you are identified maybe as an ally are you open to have that permission?
Exactly. Let me give you an example. You read into my bio, I worked with Mary Haven before I went full time with ArkBuilders. And at Mary Haven, I was part of the gambling intervention program, right? So we had data about the Asian community, this is an example, and how they may have a more at risk with problem gambling. Well, for years, OMAS tried, we need to address the Asian problem with gambling. And no one could do it. You could get general information. Well, I just I have a relationship with a Korean friend of mine. He's like my brother. And we had done some youth-led stuff or youth programming. And I asked him, I said, hey, Danny, his name is Danny now. They say Asians have a problem with gambling. Let's do this program together. Well, Danny's response was like mine when I first heard about gambling too. Well, we don't really have it. We have a problem with gambling. But the bottom line is we did a phase, and we'll talk about that later, a phase 1 with gambling, and we wanted to expand it. OMAS loved what we did or what we were doing. And we wanted to expand it to other communities. Well, the first thing we learned is just that cultural humility. When you say Asians, what are you talking about? In Franklin County alone, there's over 25 Asian groups. So how can how can you say Asian? There's no one Asian approach. Let me rush on. So bottom line, the second year, there's a gentleman, Dr. Liu, and he started the Asian Festival. He's like the godfather of the Asian community, really. He knows all the different communities. This is what I mean by license of operate. So our second year, we said, Dr. Liu, we have this project, gambling project. We really like to get it in all the communities. So he calls this meeting. I'm just being funny. He, at a restaurant, him and a Dr. Munoz, who's like his right hand person. And they're sitting in front of the desk. We come in for lunch. We always laugh. It's like the Godfather, we sit before the Godfather. We say, oh, Dr. Liu, this is our project, and we really need you to open doors for us into the communities. After the conversation, first thing you want to know, are you just trying to use us like everybody else? No, sir. Why do you want to do this? So once we talked it through, one call, all the communities opened up to us. Literally. That's what I mean by license of operate. Every community is like that, especially if we talk about social determinants of health, we can talk about racism, we can talk about xenophobia, whatever you want to talk about. If there's a sense that what are you trying to get out of us? Until you get that license, you won't get access into the.
You've kind of led me to another thought here when we're talking about building those relationships and getting that permission or the license to operate. Sometimes I think there is some hesitancy with people when we're having some of those really tough conversations. And you mentioned humility. What does that look like to you, cultural humility?
Like I said, it looks to me that I'm not an expert on anybody's culture. How can I say I'm confident? I had to ask him, okay, Danny, who's Laotian? Who's Cambodian? What, even features? I go to African-American community, same thing. It's like we think all African-Americans are the same. There's urban, there's suburban, there's rural, there's southern, there's northern. So the humility is that I'm in the place of a learner. I'm here to learn. I want to understand and enjoy it. I mean, it's like we go to all kinds of restaurants. That's where we have business meetings at, right? Different restaurants. Because I want to learn. So if people want to tell their story. They want you to understand where they're coming from, that they're not just a category, but they have a rich culture understanding. We may have we do have things that we can help in our communities, but it first starts with, do you hear me? Are you here to serve? Are you here to empower us? That's why our youth-led adult allies is so powerful. We are here to empower people to address their own needs. That's what I would say. The humility, again, the relationships. And then the last thing, nothing about me without me. That's a new one too, right? We have t-shirts and all that kind of stuff. But it's the truth. I don't know. I have my own nonprofit now, and we were going through our strategic plan, and we noticed, we do services to young people, and we didn't have a young person on the board. So how can we say, that's why we came up. How can we say, okay, part of our main priority are youth development, and we don't have youth on the board, voting real members on the board. So nothing about me without me. And that's what our communities are saying, right? All of them.
I'm loving this idea of talking about the complexities of, groups of people, communities of people, but also like individuals. And this idea of a learner perspective. I always have tried to be a lifelong learner. And I think that that's a critical component when we're talking about anything in our lives, no matter the person, profession, etc. But when we're talking specifically about creating inclusive communities or equitable spaces with that learner perspective, what would you recommend to people when we're talking about hard conversations and trying to be educated, but also like that idea of, okay, we're going to make mistakes because we're human, but how do we navigate that?
Again, and I can hear Derek and a lot of people. Relationships. It's amazing the questions you can ask when people really know that you care. I've had opportunity lately to work in a lot of Muslim communities, right? Up in Muskies. I'm not a Muslim. It's okay. But I had dinner with my Ohio and Arabic people Wednesday, and we're talking. We have a big gambling project there too. But to be able now, after 2 or 3 years, to ask questions about faith, people, that's supposed to be out of bounds, right? But just to understand the differences from our perspective so that we can better deliver youth-led programming. Because as youth-led, we do believe in change, right? We believe in empowering kids to develop their voice to change. Well, there are some cultures at this point that may not believe that. It can be from their background. It can be from their faith. They believe it, but it's different. Let me say it that way. So what we have to find out, and I talk to our groups all the time, is how can we put this change agent in cultural clothing so people will accept it? Because if they get it, it's going to empower the young. But it's not contrary. I don't believe it's contrary, for instance, what we're talking about, to their faith. It's just we don't know how to address it yet. We do a lot of stuff with mental health. Same thing with mental health, right? And stigma. I am amazed as you work with different groups that we all commonly have stigma. We're all, especially around mental health, which is a social determinant of health, right? Access to mental health and health services. But if there's a stigma, you won't access those services. So we're working to figure out how do we speak it in a language that people will can receive. So that's what I mean by listening. That's what I mean by, I believe as adult allies, we do have a power. I know we do. I've seen it work. But I also know that we have to put it in people's cultural understanding. And if we do, as we do that and grow together, we're going to see real change. A lot of people talk about upstream, downstream, right? I'm a community-based person. I believe in upstream. I need to get better at advocacy and stuff. But I believe real change comes downstream. And we push up.
I like that analogy of working downstream, pushing up. And I think your analogy too of comparing it to languages and communication, it takes time for all of us to understand what the other person is saying, where they're coming from, their experiences. And that really shapes their worldview, their actions, their aspirations.
Yes.
And another thing that I was hearing from you too was even data, like what you're talking about is data as well. And we know when we're talking about Ohio Adult Allies, what that does. That data equips us with the knowledge to make informed decisions that help us reduce those gaps to access and availability of resources, and it allows us to build protective factors for our young people. So,
Yeah.
what are some strategies that you think can address the structural or social determinants of adolescent health within BIPOC populations that would reduce issues or disparities?
Data is just like learning culture, just ongoing, and it's fluid. And the more we talk and study, we refine our data. So I have a belief that and I'm just older, we have enough data. We know what the determinants of health are. People have been studying that for years, right? They really have. And again, I'm touting what we do as empowering young people. The data is there. We just need to help young people and adult allies to really look at the data, apply what we know as prevention science to those issues, and we'll see a difference. Now, we call it incubators for success, right? And it's the 3 basic youth empowerment principles: caring adults. So we believe in caring adults. High expectation, because we believe in resiliency. We believe in the power of young people, no matter where they're at. So we have high expectations for them. And then the powerful thing is that we, as youth-led programming, we give them the opportunity to develop their skill. And once they do that, you've experienced this too. Once they do that, then they can address any issue. That's what I told the leaders. I said, let us teach you the SPIF. Let us teach you youth-led empowerment. Let them identify the issue that's concerning to them. Let them work on it, see success. Then they will develop, they can address any of our social determinism once they learn principles. That's why I love Dr. Holly. And when I first started, it's not, youth-led is not a program. It's a framework. So we have seen, like, we've addressed mental health, a lot of mental health stuff. I am convinced you talk about data, and starting to come out the effects of COVID on our young people. Now, we had issues before COVID, right? But now with that isolation, our opportunity to help people is just increased. So big 3, example, caring adults, high expectation. And I could go up there. You talk about communities where that's not there, high expectation, where you categorize kids at risk. You know, I always tell my kids, you're not at risk. You're in an at-risk situation or circumstance. We can talk about education as a social determinant, can be, for education. So high expectation, and the main thing is for the opportunity for them to develop their skills in a safe environment. That's taking that data and addressing these issues, right? I could go on and on. You can see that, right? I could go on. I'm excited. The thing is, we talk data, and I'm not against. I love data. Like the article you gave me on social determinants, health and children and youth. I mean, I ate that up. But it's also an encouragement that we are doing those things as adult allies. And we are doing those things in our community. So it is confirmed, the data confirmed what maybe intuitively we have believed. And then adult allies gives us some tools to produce a framework to produce what we really believe. And that's helping young people in healthy communities. This next generation is going to deal with some of this stuff, aren't they? They're going to deal with racism. They're going to deal with homophobia. They're going to deal with lack of education. They're going to do it. Now, what we can do is, as caring adults, is get behind them, which we are as adult allies, empower them to really do it. And the amazing thing is historically, most movements were done by young people. Most major movements had a large portion of young in it. So we have a real opportunity, Tina.
Several things came to mind when you were talking about having high expectations for our young people, right? But we don't necessarily, there are people out there who don't have high expectations for our young people. There is a balance to be had, I think, by and it goes back to that piece of understanding where people are in their journey or in their environment, right? We're meeting people where they are, but also understanding their potential. And we know that another barrier to empowering young people are other adults who don't see young people as social change agents.
Yes.
How would you, I guess, guide other people, or what advice would you have for adult allies who are working with other adults that perhaps aren't as encouraging, or those that don't see young people as valuable?
Okay. I hear Karen up north in Ohio in adultism. We do trainings together sometime. There's going to be a tension. I wish it wasn't. Empowered people, scared people were in control. I mean, that's the way it is. And so we just deal with it. but there's going to be a tension. But I think what will help, some people can read, some people need to see it. If they can see empowered youth doing positive things, articulating what they really believe and doing it, I think a lot of adults, I just think we've all been trained that adults are in charge. You guys just sit back. The whole phrase, you're the next generation. You're our future. I don't believe it. What I tell you, you're the now generation. Because when is next? When does next come? So now I have people who are seniors, they're still in the way. I tell them you're in the way. It's time for a transition. It's time for you to become a consultant. They said 45 years ago, the next generation, you won't let them come forth. So I would just say, it's going to be a tension. But if they can see, once they see, wow, these young people are really about making change. How can I help them? So I guess us as adult allies, we can help them become advocates. Don't you want this? You wanted it for yourself. They're the ones who have the energy. So we have a work as adult allies, you're right, to help other adults get that word out of empowerment. Thank you. We really do. And I guess in OU, where next year, this is probably, I shouldn't say this, we're going to begin to do that more too, right?
That's our hope. Yeah.
That's our hope. We're going to do it. Explore, give people even that initiative to begin to explore, what is this youth led?
Mm-hmm.
How can it help?
And I think what your words kind of sparked in me too was a strengths-based perspective.
Yes.
Instead of focusing on the barriers and the adults who are not willing to see the value in our young people, instead let's focus on the people who are. People who are creating spaces and room at the table for our young people to have voice and choice so that they can change now. Versus later, you know. And I love that generation now instead of the next generation, the now generation, because change is made in small increments over time. It's not necessarily us waiting for, 5-year mark and some huge piece that we're going to look back in a history book necessarily. It's these smaller increments, these actions and choices that we make every day that impact tomorrow.
You're right. I agree. And that's our opportunity, right? Sometimes I think, and this is just me, when Black Lives Matter really was hot, I look back and say, man, what if they had our youth empowerment framework? Right? And what they were doing was perfect, excellent, excellent, excellent. But it takes time. It takes a framework. It takes a strategy to make real change. So one of the things, and I know we don't have 2 hours, one of the things I'm beginning to think on and work on, besides education and prevention and youth-led, in a youth-led setting is civic understanding and responsibility for young people. That's that bottom-up approach. Really going back to say, if we're talking about youth empowerment, then we need to understand civics. And like for a lot of our BIPOC, particularly the new American, they come from countries either war-torn, they could have been in refugee camp, their government, but it was not a representative form of civic engagement. And even our Black and Indigenous kids and Hispanic, Latino kids, a lot of times we feel we're not empowered and they don't understand civic responsibility. It comes from the bottom up. So we let leaders run things instead of it being a representative. So I'm thinking on that.
When you're talking about this, I'm thinking of nurturing that sense of purpose. And that I feel like relates to what you're talking about, that civic responsibility. We individually need to know that we are worthy, we're valuable, we have strengths and capabilities that can affect change. And until our young people understand that connection, the other stuff really won't make sense.
It won't make sense. And data and history, one of the things in strategies, one of the strategies that we really use is people learning their cultural history. You say, how's that prevention? And because they need to know where they came from. And I don't care what community you come from, your ancestors endure some things and overcame, right? For me, ours immigrated from, I call myself a second generation because we immigrated from the Deep South, Jim Crow. I could go there, but I won't. When we did our study with the Asians, the first thing we did was the immigration story of the 12 largest Asian groups in Central Ohio. People understanding that, first of all, you care about where we came from, was empowering, like you said. So now we're working with a Bantu Somali group that's doing the same thing. And the Nepali group, they're developing, their project was to develop a podcast to interview the first generation Nepalis because they're getting older and they don't have a history. Because they were in a refugee camp for 25, 30 years, and they were under oppression for 250 years, and their history was never recorded. So you come here and you just feel like, who am I? You're talking about social determinants. So why do I have hope? Why do I press on? And the same with our Bantu Somali people. So that's another strategy. You just made me think about it. But you're right. It's all about purpose and hope. That's that resiliency piece, right?
And to amplify your words, producing greatness. We have the opportunity to produce greatness. And I think that's specifically through giving people an opportunity to have their voice heard, to know who they are, to tell their story, and to give them that chance to really make decisions that are going to affect everybody, not just them.
Everybody, yes. And we all need it. People ask me, well, why do you work with these communities? Because it helps all of us.
Yeah. We're all in.
We are. And that's what people don't want to deal with. You cannot oppress another group too long, forever.
Yep.
And we're all intertwined. In America, we're intertwined. We are here to stay home. So
Yes. I think it was, and I don't quote me directly, but Elie Wiesel, he was a Holocaust survivor, right?
Yes.
And one of the things that stood out to me in his book was the idea of neutrality and how neutrality favors the oppressor.
Yes.
So it's up to us to really advocate
Yeah.
and include other people so that we all win.
Yes.
So thank you so much, George.
Well, thank you.
I knew it was going to be an amazing conversation because of just who you are and all that you do for the communities. We thank you. Again, I am Christine McGill, and I hope that you all enjoyed the conversation today. Feel free to check out other podcasts on the Ohio.Allies website. And our challenge to you is to embrace, embolden, and empower others whenever possible. Thank you.
Thank you.
We would like to say thank you to our special guests. For more information about their organizations, feel free to use the information on the screen or below in the description. Thank you to our listeners. This has been the Ohio Adult Allies Podcast. For more episodes, you can find us on Spotify, iTunes, Google Play, YouTube, and more. You can also find our episodes and more information about us on our website, ohioadultallies.com.